Hey guys, Don here. Welcome to the $1 Million Minute, kind of going over what helps to get to the $1 Million practice and beyond. I have a lot of notes on the recent Shockwave course. I'm going to put those notes underneath this podcast for you to look at. It's a link to my Notion. Basically, Notion is a booklet which is where I put all my notes. So if you want to look at my notes, you can kind of look at notes to different things. If they're helpful, that would be happy. I'm going to eventually put these into a little master class on it, what I've kind of learned. So I'm not going to go all over that, but it was a good conference. If you've never done the Shockwave course, I would really recommend it. There's also a new American Society of Shockwave, which I just joined, which might be interesting to you. I think the key is like education. I think the more I learn about something, the more I'm going to do that thing. And I find the reason I don't do things is because I don't understand them or believe in them enough. Okay, let's go into my Monday. Monday was kind of a frustrating day. I don't usually vent to you, but I do have frustrating days. And this day, the two things that kind of frustrated me were I had a couple of patients that either maybe I was kind of out of things because like I have some personal things going on, like my dad has dementia and he's coming to live with us here in Massachusetts, so that's like kind of new thing, arranging the house, things like that. Could have been me, could have been them, but there were two patients. One came in and they had pain, and I recommended Shockwave for like Midfoot Arthritis, and then they didn't schedule it. Not that they didn't schedule it, that's not the bad thing, but maybe I wasn't too good at explaining it, kind of how it would help her. So that was one patient. There was another patient that really was still in pain, but they didn't want to do anything. They didn't want to do anything about it, and maybe that's their choice. Maybe it shouldn't be to take it on myself, but I recommended ultrasound, and it wasn't covered, so they didn't want to do it. They didn't really want to do any other treatment, and because it wasn't covered by insurance. So I think those are patients that would, when things aren't covered by insurance and they don't want to do them and they're not interested in anything else that insurance was covered, I just really am not too motivated to see those patients back. So that's just kind of my opinion. I know that happens once in a while, but you get my rant, so you get to see I have a normal rant just like everyone else once in a while. Okay, so first patient was a post-op patient that I took a Neuroma out. I transitioned her to a cam boot. One key, you probably all know this, but I'm just going to say it in case some might not know this. At the OR, they usually get a surgical shoe, and then when they come to see me, I put them in a walking boot. I don't put them in a walking boot because I can bill for it at the follow-up. So walking boot, this patient was a neuroma removal, and she's doing much better. Next patient was an orthotic dispensing appointment. So saw that patient dispense the orthotic. It's feeling good. They're going to do a 6-week. That's what I tend to do after orthotics, is a 6-week follow-up. Another patient came in, was a new patient. This was the one that had kind of midfoot pain, and I got x-rays, showed her all the midfoot pain. It was painful, stopping her from her activity. She already had orthotics. She's already tried other things. I do think either cortisone or the Shockwave would be helpful, and I guess she was going to think about it. Okay, and so that was kind of the one that she might just be used to living with it, so that might be the issue. Another patient that came in, she was for a fracture follow-up. So once again, for my fractures, when I diagnose them, I do the fracture code for most of them, and I just try to do one follow-up. So this one was a 4-week follow-up, doing much better, no follow-up after that one. Next one was the EPAT. This was EPAT number 4. This is the gentleman with the 5th Met, had bursitis, doing much better, had amnio at visit 2, doing much better. Another patient that came in was a new patient. This was a kind of a second opinion type of a patient. They were kind of concerned what to do. I took a nail sample because they really hadn't had a nail sample. They've been doing all these treatments for nail fungus. I also recommended looking at her bunions and Taylor's bunions. And sometimes if I don't have time or if the x-ray hasn't been done, I'll do the x-rays at the next visit. So this is kind of a tip for me to save time. So if I'm with the patient, and usually my staff gets x-rays, I'm not going to have them get x-rays and then go back in the room. Usually what I'll do is I'll have them come back, like for her, she's going to come back for the nail sample, and then at the next visit they'll get bilateral x-rays. That's just the way I do it to make it a little bit more efficient. There's another patient that came in just for callus, and there was a callus and ulcers, and I did ulcer debridement, so they'll come back if that ulcer doesn't close, but it should close. It's more like a fissure than it was an ulcer at the tip of the big toe, a really bad fissure. Another patient was one of my other post-ops. This was a patient that I fixed the 5th MPJ, where it was dorsally dislocated, and there's a pin in there. She's doing great, so she's going to see me back to pull out the pin at 6 weeks. Other patient came in. This was a 78-year-old female that had pain to the peroneal tendon, and I showed her this on the ultrasound. We did get x-rays. I did recommend Shockwave if it doesn't get better. If it doesn't get better, she'll schedule that. Another patient that came in for Achilles pain was a follow-up, and he was given meloxicam, foam rolling. He did not want the night splint. And this is one that kind of frustrated me. Well, again, this is another patient that frustrated me. I recommended night splint. He oh, does insurance cover it? And I said yes. He wanted to know it's deductible and all these other things. And so he'll come back maybe another time to get it. But those are ones that are a little bit of a challenge. Same thing with ultrasound. I did recommend the ultrasound. He was concerned because insurance wouldn't cover it. So maybe it's me being unsympathetic to those things. But most of my patients don't have a problem, so I guess if there's a few, that's okay. Another patient that came in with foot pain, I got with a fracture, so she did fracture code. She also had some balance issues in neuropathy, so I did recommend checking on coverage for neuropathy for this patient. For the balance braces. That was the morning. Afternoon was a patient. We did a Hallux avulsion. He kind of hit his toe, came off. Another patient that came in. This was actually a daughter of one of the women I work with at the gym. I do something called the Fitness Asylum, which is like a boot camp. And so I saw her daughter. I showed her a magic trick because I show all little kids magic tricks. So if you want to see my magic tricks, just ask me. And we did cantharidin on the wart, and I'll see them back in 3 weeks. They also got 5-fluorouracil for that. And so I find kids, they tend to respond pretty well with the cantharidin. That's why I didn't jump right to the Swift, okay, and see how she tolerates that. Another patient came in for a neuroma. I did x-rays for the foot pain, ultrasound for the neuroma, and then an injection for the neuroma. He'll come back as needed. Another patient came in for because of a nail issue and follow-up plantar fasciitis. The plantar fascia is better, but had concern of a nail, so I did a nail sample on them, and then I will call in the medication. This was another one that I felt like they just didn't want to do anything for their plantar fasciitis, and so for the nail sample, I'll just go over the phone. I'm not going to see them back, because I doubt if they don't want to do anything for their plantar fasciitis, they probably don't want to do all the other things I'm going to recommend for them, for the nail fungus as well. Next patient was a patient that came in, kind of a family member of a kind of family member, and so they had a wart in the back of the heel. I excised it because there was just one wart, and they're going to follow up as needed, so no follow-up for that. Another patient came in for Shockwave for the Peroneal. This was EPAT, and I think number 1. Other patient came in for Shockwave to the first MPJ. Now, this patient has quite a bit of arthritis to that first MPJ, and we're trying to avoid doing a fusion or anything else in that big toe joint. And the patient does not want a cortisone injection, so we did Shockwave, and it was pretty painful. And I think that indicates how much pain she's in, but also there's probably some bone marrow edema and other things going on. So we are trying the Shockwave for that. I don't find Shockwave works stellar for arthritic pain, but really she doesn't want cortisone, and we want to avoid surgery, so she already has orthotics and like the Morton's extension in there, so we're going to try this. Another patient came in for a couple of things. One was a cyst to be drained, so I drained that cyst after numbing up the toe. Had a porokeratoma, so I did lesion destruction, and I did x-rays to look at the foot, and they'll follow up as needed. Another one was an EPAT for foot pain, kind of like plantar fascial pain. Another one was bilateral Achilles EPAT. This is the second visit. I'm like her third opinion. She's already had like Softwave and other things and wasn't getting better. Okay, so that was the day. Kind of a frustrating day. I haven't had a frustrating day like this in a long time, but it might have been me more so than the patients. But anyway, I'll try to get the Shockwave thing when I can. I am, not that you guys care, but I'm letting you know, I'm leaving soon to go to Brazil for a few days, so I'm going to take some time off of this $1 Million Minutes and moving my dad, and so I might be sharing you guys my dad moving story and coming into the house. Okay, thanks guys. Have a good one until next time.